Welcome, everybody. Thank you for visiting us here at Sabiduría para tu Vida, which, we started this project uh, by wanting to impact my Hispanic community, my Latino community. I felt the need to be able to reach and impact and empower our community and giving them the resources, the ability to grasp change. And the only way to do that is by sharing our knowledge and giving people the resources and showing our fellow man that we can be the change. We can be the change that we want to see. And therefore, we started doing this in Spanish and reaching our Hispanic community. And I have invited Ivan Rodriguez, is licensed clinical social worker that we've met several years ago. And given the fact that he is a licensed clinical social worker, he deals a lot with mental health. And being that it's a passion for me knowing that I can help somebody change their thought process to elevate and inspire somebody to change, to think different, to feel better, to give them the wings that they already have, but allowing them to spread them. And that's where my friend Ivan Rodriguez has been here with me since the beginning and allowing us and sharing our knowledge. And I thank you once again. And with this time, we're doing it in English. So,
Yes.
Ivan, thank you so much. Please tell us a little bit about yourself.
Okay. So call me Ivan because only my mom calls me Ivan in Spanish, and that'll you'll take me off my game here. But yeah, no. I appreciate us coming back to this and doing this in English again. As we were sharing earlier, the intent was to make this show in Spanish, reach the Latino community, especially around topics of mental health, because we've both been affected by it in different ways. And I think for me, it's really about being in the field and learning so much and wanting to share that and give that back, especially because of some of the influences that I've had and experiences that I've had. But my background is 20 years plus now in the field, in specialty mental health. So I've served as a therapist, I've served as a clinical supervisor, various roles as administrators, and also as a program director for our children's mental health clinic here in our community. And that's 15 plus years as an administrator, and I've also teach for a university, so graduate students, and so I've had a hand in developing many clinicians. And so again, just my own personal experiences, family experiences within the Latino community, generational trauma, adverse childhood experiences, and just treatment in general with behavioral health, suicide prevention, because I serve on a task force here in Tulare County, suicide prevention. I also sit on the behavioral health board for the county, and I sit on some advisory councils for our local hospital, Cahuilla Delta. But the goal is to reach our community, and the topic is it's September, and September is Suicide Prevention Month. There's a few other dates that we will acknowledge and recognize as part of this month and suicide prevention efforts. But the conversation yesterday in Spanish seemed to have moved you, Alvaro. I shared that it moved me as well, but it was really more about excitement because this is what I do. And I want to share as much as possible. But I just wanted to give you an opportunity to share perhaps why it moved you and why we're here today doing this in English.
Well, we have been touched in many ways with mental health. And one of them that really makes a big impact is losing a loved one. And when you go through that phase in your life, it changes everything. It how you see life. Why did you or someone say anything? Why didn't they try to reach out? And the thing is that sometimes we are not paying attention. And today, uh, I think one of the biggest things that we're going to present and show is the different ways to see somebody that is in a crisis,
Mhm.
see the different symptoms and the
Yeah.
different signs that they're going through, which suicide is such a horrible thing because we were discussing, as we were discussing yesterday, the numbers. The numbers are
Yeah. Let
really, really impactful. Go ahead and share.
and depending on how much you want to share, I know you've experienced it in your family, right?
Yeah.
And I've experienced it in the field, right, as a provider, and seeing that happen within a clinical setting. That has really driven me in terms of the work, seeing the loss, right, and seeing the pain of a mother who lost her child and is entrusting, right, our systems of care. And there's certain things that we can do, right, to help and support, but the theme always comes back that suicide is preventable. The research shows very clearly that if we get people help, that symptoms will improve. And so but for me personally, having experienced that, meeting with a person who ended up committing suicide, dying by suicide is the appropriate term, um, really affected me. And I applied myself. I would say that that's the most influential event in my career in terms of trying to make sure I'm doing everything possible to prevent it. And the way you do that is by making sure you're relying on outside support in the context of professional organizations that have already done the research. So I'll say something like a joint commission is an accreditation agency that advises hospitals and behavioral health providers. That was extremely helpful to me, using evidence-based practices and staying on top of research to ensure that the work that we're doing is at a very high standard. And oftentimes that involves more work on practitioners. But I use this notion of the pain of discipline and the pain of disappointment, and that actually comes from the realm of sports. And usually because teams don't want to lose a game, when I apply that rule to the work that we're doing, and we don't want to lose a life, that means that sometimes it's absolutely okay to do more work if that's what's required to make sure that we're doing this and we're doing this to the best of our abilities. And so I will then shift and speak to impact. And yesterday we started off by sharing the general number. The CDC says that in 22, 23, we're seeing over 49,000 deaths. There's different sites. One particular site reports that we had more than 50,000 deaths by suicide in 2023. And when I just checked the source itself, I think the number was 49,316. So we'll go with that. We'll go with the CDC, 49,316. And if you do the math and divide that by 365 days in a year, I believe the number that we got was 136 a day.
Yeah. 136.
And 36 deaths by suicide a day. We that translates to one death by suicide every 11 minutes. Let that sink in, right? One death every 11 minutes. So it is a public health issue in terms of making sure that we're discussing this, just as if it was a physical health issue. So when we talk about mental health, when we talk about the impact of suicide, we want to make sure that we're having these conversations because it's preventable. When we talk about children and youth, it's the second leading cause of death, and it's preventable. Think about what we do, Alvaro, for our kids before they get the wheel behind the wheel of a vehicle. What do we have them do? They have to
Practice
take a class. Well, not
class.
before you even practice. You have to be in
Right.
school, take a written test,
Test.
and then eventually you're going to have to go to the DMV,
Yeah.
pass. So pass the test. You have to practice in safe environments, right? You don't do what my dad did and just take me out on the road to practice just to, you know, put you to the test.
Yeah.
But we practice. There's written knowledge before you ever drive a vehicle, and then there's insurance and all these other expectations, requirements, so that you can drive a vehicle.
Right.
And I mention vehicles because motor vehicle accidents are the number one cause of death with adolescents,
Yeah.
and the number two leading cause of death is suicide.
Suicide. Wow.
So again, those are very staggering just amounts of information for us to take into account when we look at what we're up against. And so again, that's the data piece. And so I know you had some reflections on that.
Yeah. No, and I think one of the biggest, one of the issues that we have or we face is when it happens, we don't talk about it. Families want to sweep it under the rug because they feel ashamed
Sure.
that they don't they that somehow it's a reflection of them, and it's but the thing is we tend to just kind of suppress those feelings, suppress those emotions. We don't want to talk about it, and so it goes unsaid. We have memories of, and we speak very little of the person that ends up passing, and so we end up losing the opportunity to
So
discuss
let's talk about that.
main issues.
So the reasons behind that, I go back to stigma, right? Stigma that is influenced by our culture, by our upbringing, by our religious beliefs, right? We talked about from a Latino perspective. The reason it's difficult to have those conversations oftentimes is simply because, from a religious perspective, it's viewed as something that goes against our beliefs, and that elicits shame sometimes for family, and so that contributes to it. We also have the perspective of that we discussed yesterday in terms of the lens that we might have that is based on a patriarchal society, a to use machista lens, where it's about alpha male perspective, toxic masculinity, and we're saying that person. These are some of the words we've used or we've heard in the past. Growing up in around our communities, I grew up in South Central LA, South Central, North Side Visalia, right? So I'm around Latinos, different cultures, but that particular way of thinking then labels these situations as, yeah, and these are things that you've heard, and I even hesitate to say it, but this is the truth, and this is what we hear from our community. They chose the easy way
Easy.
out. They
Yeah.
chose the coward's way out. They couldn't handle it. Um, I people will then speak to themselves. I pick up by the bootstraps, and I keep doing day in and day out, right? And they were weak, and those kinds of things. And so that contributes to stigma. Stigma are myths, things that people will make up and say simply for different reasons, sometimes to help themselves
Yeah.
in a difficult situation. But those are all contributing factors in terms of how we deal with things. Prevention, things to prevent. And then we provide active treatment, that's intervention. And unfortunately, in the situation of when a suicide occurs, we have postvention. And there are supports that we offer, like an agency like Suicide Prevention Task Force of Tulare County, where we would, in collaboration with our coroner's office, we can go to an individual who's lost a loved one, and we provide some resources. We connect with them, share condolences, but we just want to make sure that somewhere down the line they have an individual that they can follow up with, call, get additional supports, and different resources that we can offer to the community, including a suicide survivors group. um, providing therapy, try to make sure we're linking them to supports. So I just wanted to share that, and maybe that's something we can discuss even more so later on as far as offering resources. But I just wanted to get back to, we have the data,
Yeah.
which is staggering. Any one suicide, it will reverberate through not just a family but an entire community.
Yeah.
The school that that child attended to, the friends that they had, the football team or the soccer team or the basketball team that they were a part of, the neighbors, the extended family, right? This is, this one loss is one loss too many, especially knowing that this is preventable. And so we know of why maybe people don't talk about it when it happens. What I wanted to segue was some of the reasons, because that was one of the questions you had, right? Well, why would
Yeah.
someone do this? And so I shared an experience that I had that was impactful to me when I went through training on an intervention called Applied Suicide Intervention Skills Training. And this was at least 4 days, possibly five. It's been a while, but I was training to be a trainer of this specific modality, and to me, that's one of the best modalities I've ever trained in, which helps with intervening when someone is potentially considering suicide. And the question that they asked, one of the first questions, once you got the basics out of the way, but one of the first questions they asked was, "Would you ever consider suicide?" And I told you that when I first saw that question, I I had a very um, what I would say, ignorance is bliss, but I had a very ignorant reaction, which was, of course not. It was arrogant on my part.
Yeah.
Of course not. I wouldn't do that. What are you almost offended, right? What would you
Yeah.
ask that? Like, I would never do that, right?
Right.
And then we started reviewing all these risk factors. And one of the first
Mm.
ones that we start off with when you look at data is, a male over the age of 40, Caucasian, probably has a high risk factor for different reasons. And then we started looking at these risk factors, including, you know, uh, financial loss. Right, someone is reaching bankruptcy.
Mm.
Something happened. Bad days with the market. Um, a relationship breakup. We shared about like teenagers who struggle
Mm.
sometimes with a relationship
Relationships.
breakup because of that lack of experience, that emotional immaturity. You mentioned the prefrontal cortex, right? Doesn't fully mature until mid 20s, and
20s,
so
right?
we talk about the bad divorces, the wife cheating on a husband, vice versa, husband cheating on a wife, you know the the, then you go into stacking these events
Yeah.
where someone potentially has experienced adverse childhood experiences that we talk a lot in Spanish, but if someone's listening to this for the first time, right, the research around adverse childhood experiences going back to the mid 90s, and 10 specific events, five related to child abuse and child neglect, including physical and sexual abuse, and five household challenges that includes separate disruption from a primary care provider, like a mother, due to divorce or just loss of a parent. Other factors, like living with a parent who was experiencing um, substance use, mental health issues, incarceration, and I'm forgetting one, but those are the kinds of, there's 10 total questions, and the research found that the higher the score, the more significant consequences you had,
Yeah.
including in the social realm and in physical health. That was the big one. That that bad experiences that are considered trauma,
Uh-huh.
or what became coined as toxic stress, which is
Right.
associated with basically physiological stress response that essentially causes the psychological stress response that we know with the fight, flight,
Fight or
uh,
flight.
or freeze response,
Yeah.
that basically your body is eliciting a chemical reaction,
Right.
right?
Right.
Where the stress hormones are activated,
Yeah.
that basically cortisol and adrenaline and all that's like flooding your system.
Yeah.
And these 10 type of experiences basically showed researchers that the more that it's activated, that the amount of time, if it's prolonged, that those experiences will make you sick and it will follow you well into adulthood. So much so that it can lead to early death. So for instance, if I remember the data correctly, six or more ACEs essentially saw a significant reduction. I don't remember the exact years, essentially in the context of loss of life. I want to say what's coming to my mind is 17 to 20 years lived less with six or more ACEs. And one particular data point was four or more ACEs created a 36 and a half times higher risk for suicide ideation. And so, again, when you think about what someone is going through and they've experienced those adverse childhood experiences, those life stressors, and then as adults, they're struggling with finances, or there's a relationship breakup, or there's all kinds of different events. And the one that got me was what I'm about to share, when it made me reflect on the danger, the risk for any one of us. And it came down to loss. And there's a sense of, there's a question that you have to pose yourself. You think, what is the most important thing to me in my life? And for me, it was my children. And at the time, my children were babies, they were small.
Yeah.
And I still, right, I love them more than life itself.
Yeah.
And how would I react if I lost one of them?
Right.
And that's probably the extent that I can talk about this, just because I love him so much and I don't want to even envision that.
Right. Right.
But
It's so it's something that you would fathom thinking,
what
oh
is
my
that,
God.
right?
Right.
And yet, what would push a person, right, to consider suicide? And so the answer is any of the above. It
Hmm.
could be one thing, it could be 10 things, it could be past history, it could be current. There's a lot to consider. And what it did, that training did, is simply it humbled me
Mm.
to know that I didn't know everything. I was naive, as I said. I was ignorant in that regard.
Yeah.
And as we study this subject, as we review it, as we gain experience, as we interact with people who've gone through this, and we see the survival, the resilience, this is why we're here, and we want to share this information because, again, the big takeaway from today is that suicide is preventable.
Yeah.
But those were some of the reasons, right? And I wanted to give you a chance to
Yeah.
reflect.
And yesterday when we were discussing the subject, we went into how early development, and we see this a lot, and I'm sure you see it quite a bit since you work in the school district, that kids, they are growing up, they're trying to figure out the world,
Sure,
and they go through all these emotions, and being able to confront, trying to be able to confront those experiences in a very young developing mind is so overwhelming. Now, many a time, the what they're looking to do is to be seen and to be heard.
sure,
And sometimes when they're being either confronted with eh, perhaps bullying,
sure.
or even in a relationship where there's perhaps abuse, or they're
Right.
reaching out and they're being ignored. So you see this a lot. And so,
Absolutely, absolutely. So what I rather than get into specific situations, and you're not wrong, like everything you just said is pretty spot on, but I've taken a much simpler lens to this.
approach.
It's really about being trauma informed and then practicing according to trauma informed practices. That there's a that's a function that requires training, so that everything we do is involved with that, and that's part of how we break generational trauma for ourselves. And so the way I look at it is, what causes anyone to become stressed, and how do we manage that?
Mm.
And how have we learned maybe from an early age to deal with that, which can either cause, because there's a potential to re-traumatize and not help improve that process. And what we're going to see, so when you see a person who is maybe aggressive, well, maybe their psychological stress response is associated with fighting.
Hmm.
And in some cases, something might be feel so overwhelming that in some cases that's why the person chose or just thought about suicide. And we'll talk about this in terms of simplifying that even further. But I will share just a very brief example. Just seeing a little boy the other day who made a mistake, and he had I happened to know about the situation. It was a threat assessment, and in the context of that situation, the the boy basically wrote something in his computer that he meant for a video game. And so, there has to be a response that takes place with school, and so they did their piece, and they thought, hey, we're good. It's not a threat. It's not an issue. We're good. So, but I happened to see this little boy, and just coincidentally, and he was crying. He was emotional. And I'm thinking, wow, let me step in. Let me check in with him. So I checked in with the little boy, and I just saw how overwhelmed he was, not because of the situation that happened with the principal, but what's going to happen when he's confronted with the mother. And and interestingly enough, we were able to work through it, connected with him. Within a few minutes, we were already, smiling, and put things in perspective, prepared him to share what needed to be shared. That was really it. Just put it in perspective. In fact, I shared this with you, but the first thing he said was, when he felt comfortable talking to me, he said, "I just did something stupid." And the way he was thinking about the consequence was way beyond
Yeah.
what ended up happening. In fact, mother was amazing, handled the situation because it happened to be there. But I'm wondering, how many times
Mm.
do people in other scenarios, when they feel overwhelmed, didn't have someone to talk to them, to help them regulate?
De-escalate. De-escalate.
You say de-escalate, I say regulate, because I
Mm.
tie it to physiological stress response.
Mhm, okay.
Because if you think about, and this is a whole nother like discussion training presentation, but I'll try to be brief. Anytime we are facing with a life stressor, we're going to have a reaction, right? We're going to have a reaction. Our heart starts racing, we get the adrenaline going, or we just, again, go through this response that basically it's about how we handle the stress. And as I said, there's all those events, and those events can cause a significant stress response. And if we're overwhelmed and don't know what to do, there's absolutely, possibility that someone's going to make a decision that they didn't think through. That's impulsive. And so that's why we're going to eventually talk about providing that connection, that support, and what we would do. 5 specific steps.
Yeah.
Having said that, one of the things that helps demystify the concept of suicide is knowing that when you say that word, again, when you say that word, and we think about it in the context of a crisis, what kind of crisis is that?
It's
Zero,
detrimental.
zero to 100, and you hear the word suicide,
Yeah.
crisis, we're probably thinking 100,
Yeah.
right?
100.
So one of the things that I've just been able to glean over the years, and a particular tool that I utilize, it's called the Columbia Suicide Severity Rating Scale. Amazing tool developed by Dr. Kelly Posner out of the University of South Carolina, the Medical School of South Carolina, in collaboration with, Medical School of Columbia. Sorry, I said South Carolina because they focus on trauma and abuse and treatment for different training. So that's trauma focused CBT. The Medical School of Columbia and other universities, including Pitt, the University of Pittsburgh, got together, did some research, starting with adolescent girls, and focused on preventing suicide. And they came up with this amazing tool that provides indicators for the level of severity. And so the first question is really about avoiding a situation, escaping a situation. So the question is just, have you ever, thought about, sleeping and never waking up? And in the context of a crisis, people often just want it to end. They want the situation, the bad situation, to end. It's overwhelming. I gave you an example of a individual who was close to me, who is close to me, when he dealt with for him in the moment, catastrophic situation that had a lot to do with how he perceived his identity, his value system, religious beliefs. I mean, this is who we are. For
Yeah.
him, this situation was massive. And when I spoke to him, he said, I wish the earth would swallow me whole.
Yeah.
Right? Because he just wanted this to end. He wanted it
Right.
to disappear. And so, in the context of thinking of an emergency, this would be a very mild level. I'm not concerned that they're thinking about suicide.
Right.
Now, now they didn't say suicide, and that's part of like we'll talk about this, that we want to ask about this, right? Because the second question is, are you thinking about suicide?
Right. Right.
Because now it becomes cognitively, we're thinking about how bad this is. We're wanting it to end. We're wanting to, the situation to resolve itself, and it's overwhelming. But the next level becomes, if the person says, yes, I'm endorsing thinking about this. And so the third step is there some kind of method that the person is thinking about, right? So then you ask that question: is there a way you would do this?
Yeah.
And so that's where you get into. Before I go further about method, when we ask this question, Alvaro, thinking about suicide, it's such a powerful question that essentially gives the person an invitation to speak to something that they're holding inside. Why? Because of all the things that we talked about in terms of stigma, the perception, the things, that the way people conceptualize, the suicide, or even thinking that someone might be thinking of suicide.
Now, quickly, Ivan, what about, people sometimes resist talking about suicide or even bringing up the word suicide because, oh, well, I don't want to talk to my
So,
son because maybe he's not thinking about that. And if I
great.
say it now, he's going to be thinking about that.
Okay, so
They think it's the inverse. So
right. So
let's
here,
not bring it up because all of a sudden he's going to start getting ideas.
so this is great, right? Because I was just going to talk about this. If we were having this conversation, I'm going to approach it as an untrained approach. And let's say I'm asking you about what you're overwhelmed with these things, right? That let's just take, I'm taking I'm envisioning a video, a training video that I've used,
Yeah.
and we're talking about the experience. um, the interviewer is asking the person who's going through a very difficult time. So let's assume they lost their wife, their kids aren't talking to them, they're upset financially, he's taking some hits, and basically he says something along the lines that life isn't even worth living. If I disappeared, no one would care,
Yeah.
right? And so somewhere along the line, the person just says, I might as well just kill myself,
Yeah.
or I should just end my life, something along those lines, right?
Right. I'm
The
worth more. Worth more dead or alive than alive.
Sure, that those
Right.
statements are being said. The wrong way to answer, and I'm going to tell you why, and they demonstrated in this video, would be that the interviewer saying something along the lines of this. Let's just say the person was very open and sincere, and they said all these things, and then I follow up that statement by saying, but you wouldn't do that, right, Alvaro?
Hmm.
So what are we talking about here?
You're trying to get them to.
I don't want to
You're
hear that.
no. You're like
Oh,
pushing away. It's like all of a sudden you're right there at the door, and then you
why?
run and hide.
But
Like,
why? Why don't I want to hear that? It would really be about my own anxiety,
yeah,
right? My own anxiety. I don't want the person to ever think that.
yeah,
So I want to try to put an end to it right then and there. That's anxiety.
yeah,
That maybe the person feels unprepared to handle the situation, but I think
exactly.
we can offer some very concrete information here that that provides an avenue to help. But first off, is it's usually the person who would be there for support who is struggling to say that because of that anxiety, that fear, that lack of preparation.
Mm,
My experience and the research supports that asking the question essentially helps become very clear about what the person is going through so that we can help them. And as we use the example, like the first aid approach,
yeah,
if someone is hurting, we want to know what kind of pain,
yeah,
right? When we go to the doctor, they even asks us, well, on a scale of 0 to 10, what's your rate your pain,
right.
right? Because they want to have a general idea of what it is and they want to know where it is.
Yeah. Where is it?
It's difficult to treat
What's
something
causing it? Yeah.
if it's difficult to treat something if you don't know what it is, where it is, or what have you.
Right.
So when it comes to suicide, we have to ask that question because it lets us know. And then as I'm sharing about the CSSRS and the different levels of suicide ideation severity, that helps us understand that again what to do about it. Now, as I'm sharing this, I'm not expecting people to, if they don't have much training in it. And by the way, the suicide severity rating scale does not require very much training. Um, but but again, I'll go back to level 3 was method. The next question we follow up with a plan. Does a person have a plan on how they would obtain the weapon? Do they have a weapon? How they bypass the lock. If they're thinking of overdose, pills, those kinds of things, and what they would do. And then we follow that up with: does a person have the intent to see this through? Are they intending to follow through with this? And again, we talk about the vacation analogy that we all think about going to a certain place. We talk about
Mm,
vacations, but have we taken concrete steps
right.
to see that through? Right, because
So
that
yeah, you're gonna go on vacation. First, you kind of research the location you want to go to. Yeah, you book your ticket. You prep your bags, and if you leave everything in order, right?
right, right. The you and even then, you still got to get on the plane. You need to ask your work for time off. You need to make sure you have the finances. There's a lot that goes in planning and preparing for a vacation. I share that example simply to help people understand that in order for a person to follow through on something as significant as suicide, there's certain steps that kind of have to happen for any human being as they think about something and turn a thought into an action or a decision behavior. And so this is why it's important to ask the question. And so I shared all of that simply because I want people to know that suicide isn't just the most dangerous thing that's happening. There's a level to this. And we need to make sure that we're asking the question so that we can help get the person the help that they need. And so unless you have any questions, I can jump right into what I wanted to share with the group in terms of the kinds of steps to help someone who might be a friend or someone who's struggling with um, potentially a situation where we have an opportunity to help someone.
I think one of the thing is the fear, our own fear
Sure,
of not being able to handle or manage a situation as sensitive as that.
sure.
And that's where these next, what is it,
Five
step
steps.
5 steps,
Five
that's where
steps.
these next 5 steps will at least give you the ability to have that discussion and better assess the situation. And on top of that, we have a resource, we have a website that will also give you the tools and the know-how on three different levels. It's
Yes.
happening to you, if it's happening to someone else,
Mhm.
or if it's somebody that you are in charge of at their care.
Like a
So,
youth. Yeah.
yeah. So, please, Ivan,
Okay.
let's work on that, and let's head forward.
So I want to use the example that we used yesterday with you as a runner, right?
Yeah.
And so we're going to use a first aid lens here. But if we think that someone needs help and they're having thoughts of suicide, and it starts with what we saw earlier, um, the signs. Actually, I don't think we covered that just yet, right? As far as the signs.
Uh,
So let's go with signs, right? And what a person who maybe is struggling with the depression or stress. We did talk about the types of behaviors and situations, right? That someone who is struggling. So we've kind of laid it out, but I'll just briefly summarize. Where the person is talking about wanting to die. There's great guilt, shame around a situation. They feel like they're a bother to others, which is going to segue really nicely with the website that we're going to share. But they're also
yeah.
feeling hopeless. They're feeling trapped. They're citing not having a reason to live. We're seeing them really sad, extremely sad, anxious, agitated, a lot of anger. They're struggling with emotional pain, and we're seeing changes in behavior, especially around planning ways to die, withdrawing from friends, they're isolating, they're giving away their valued possessions. Maybe they're making a will, and we're seeing the combination of other behaviors because just making a will doesn't mean that it's someone's at risk, right? So we take that into context. But they're engaging in dangerous or risky behavior. Maybe they're using drugs and alcohol. We're seeing those mood swings, eating more, less, sleeping less, struggling in that area. So those are some of the signs, right? In addition to some of the situations that I talked about earlier that we know someone's going through.
Yeah.
But here's the steps. It starts off with just asking, are you thinking about killing yourself? The example that I use, the analogies, I'm going to go back and forth, is you're a runner, you just fell, I saw you falling, you're in agony, you're in
Yeah.
pain, I'm seeing that, right?
Yeah.
Again, seeing the behavior, seeing something happen. Okay,
Yeah.
so if you fell, I'm just going to say, hey, are you in pain? Did you get hurt? It
Yeah.
sounds little maybe cheesy as I'm using that example, but I want to know,
Yeah.
where does it hurt, Alvaro? Where does it hurt?
Yeah.
Okay? And first of all, I'm going to stop and I'm going to be there because that's the
Right.
second step. I'm just going to be there. I'm going to listen without judgment because I don't know what you're feeling. I don't know what you've experienced. I don't know what happened to you.
Right.
So I'm just going to acknowledge that you're going through something painful. The third step is I'm going to keep you safe.
Yeah.
If I see that you fell on a rock and the rock is still there, I'm going to try to remove that rock or anything that could possibly cause you any danger. So
Right.
that's the same thing I'm going to do in my third step in helping someone who has a thought of suicide. So I
Right.
already asked, and I'm asking about specifically if the person's thinking about killing themselves. I'm going to be there, provide support, empathy, compassionate, listening without judgment. And then I'm going to keep them safe and I'm going to reduce any potential access to lethal weapons or places or medications. Of course, I'm going to be respectful and ask to offer this help. And so afterwards, I'm going to help connect them, and we talk a lot about 988. That's your suicide and crisis lifeline.
Right. Right.
So if it's an immediate danger where someone's already injured, there's that potential for someone needing medical attention, then go 911.
Right.
But just basic numbers in terms of calling someone, getting them
Right.
connected.
Knowing the difference on which one to call is super important, because if you
Absolutely
see an empty bottle of medicine, and there's that is a urgent, so
becomes
you
a
need to call
medical
the
emergency.
right
So
medical emergency, or if they're bleeding and they somehow cut themselves, that is an emergency. You need to get 911 there. At that point, you need to be a stage high alert,
right.
making calls.
And again, 988, you can call, and remember, you can text.
You can
Well,
text as well.
you can chat with using that. You would have to access it on the website.
Yeah.
Um, but again, if this goes back to the analogy of being injured, once I establish where you're hurt, that it's hurting, I'm there with you. You explain what's going on, what happened. I'm keeping you safe. I'm removing access. Then I want to call someone to come help you. All right. And then once we establish, I want to say with 988, they're connected to different regional centers, and they will connect you to local resources, provide that support, barring that it's not an emergency. But again, there's different programs like crisis stabilization units, different crisis supports. In Tulare County, for instance, we have the mobile crisis response team. And so again, these are some of the resources that you would get connected to if you called 988. And the last step, Alvaro, is just follow up, right? Follow up, stay in touch to see how that person is doing. I said in the Latino culture, whenever we know someone's going through something, we go by, we cook them a meal. We want to make sure that they're doing okay, right? The text messages, the
Yeah.
in-person follow-up, just to see how they're doing. But those are the
Right.
5 steps.
That not very complicated, pretty
No,
simple, 5 steps. And we're going to go through, and we'll be showing the website so that you can kind of it'll help you kind of refresh, because it's going to be necessary to be able to at least uh, ingest the steps
I, I did want to
very.
say, Alvaro,
Uh-huh.
before I forgot, because when we talked about helping and connecting in September 8th is
National.
988 Day.
Oh,
So
wow.
we're raising awareness for the crisis, suicide and crisis lifeline.
Yeah.
I mean, we're talking about it right now, but it's September 8th. National Suicide Prevention Week is September 7th through the 13th. World Suicide Prevention Day this year is September 10th. And a couple other dates that I just want to throw out. September the 17th is
Yeah.
National Physician Suicide Awareness Day. There's some being a doctor and the stresses that they go through, unfortunately, also has some high risk for suicide, and there's a recognition of that. And then on September 26th is the National Law Enforcement Suicide Awareness Day. Again, unfortunately, our officers and our doctors oftentimes are exposed to trauma, and the goal here with talking about this is to encourage, again, the reduction of stigma and understanding that suicide is preventable, whether you're an adolescent or an adult, whether you're a professional or you're not. It doesn't matter. Suicide is preventable. I just wanted to share that before I
Yeah.
forgot.
No, yeah, it's definitely steps that we can do and take, actions that we can really embrace by communication,
Yes.
talking, educating ourselves, and what we're doing right now is just talking,
So
really
let's go to,
letting people hear other perspectives, because what we don't know, right?
absolutely. You never know what someone's going through.
Yeah.
But I know that some of the listeners won't get to see it. But
Yeah.
let's, for those that do get to see this in video, let's show them the website. This is never a bother. This was a toolkit turned into a website. By toolkit, these are some guidelines in terms of what we can do to help someone who's struggling with suicide. And as Alvaro said, there's 3 pathways that can help us. But before we go there, I just wanted to share, this was developed primarily for youth and young adults, but it's really great information. It can help anyone struggling with thoughts of suicide. And so this was informed by over 400 youth, if I remember correctly, from different organizations across the state, including an advisory council for this project. It was put together by the California Department of Public Health as part of the CYBHI initiative, which is a Child and Youth Behavior Health Initiative, all about providing behavioral health support. And this is specifically about providing help resources when it comes to suicide prevention. And what you're currently seeing is the specific information link associated when someone who is struggling with thoughts of suicide, and what information would be helpful for that person, and questions that the person may have that are provided as a Q&A for that individual, including resources in terms of getting some help. And so the example that you just shared, Alvaro, can you go up a little bit on the screen so I can, or the other way around,
The
go
other way, up on top.
so yeah, so go scroll down, and I'll just share some information from this. So this
Okay.
is, I'm seeking help for myself, right? And so the prompt is, I'm having thoughts of suicide right now. What should I do? And the message is one of compassion, of affirmation in terms of the feeling of pain that they may be struggling with, and then information as far as 988 and additional lines specifically for teens. And this is free of charge. So I don't want anyone to think they're going to get some kind of bill or what have you. And then as you scroll down a little bit further, Alvaro, the additional questions. So, like, for example, what else can I do? And if you scroll down, there's certain activities, right? So in this case, challenge your thoughts, right? Check out a particular video, focus on getting through the next few minutes, breathe in and out for a count of 4, hold for 7 seconds, and then breathe out for 8 seconds. This particular breathing exercise is one that is, I really like that because it's utilized by, in fact, the Navy SEALs whenever they're going through missions, because Navy SEALs are human too, and they experience anxiety. But it's a proven method, the 478 method, to help relax ourselves. And remember, we talked about the physiological response that we might be experiencing when we're overwhelmed. So it's really specific to targeting that. What else can you do? Making your space safe, right? Asking an adult to help remove items. That goes into the 5 steps, right? When we work with someone. And so removing those lethal items that someone might be thinking about utilizing if they were at that level of method. And so again, it's just really useful tools. So if someone doesn't remember the 5 steps, this website, never a bother, is it .org?
It's never a bother. Oh boy, where'd it go? Neverabother.org.
Yeah,
Yes,
never a bother.
neverabother.org.
And for those of us that speak Spanish, or if we need to provide this information in Spanish, there's the language translation icon on that same page, upper right hand corner, and again, just additional links. If a friend, so if again, this is tailored towards young people, but folks in college, I just sent this to my kids, Alvaro, because they faced a situation that involved one of their peers,
Right.
and so they reached out to me, and I shared both this information, this website, and the Saluna app, right, in
Mhm.
terms of accessing help. Now that Saluna is limited to, I want to say, 25 years of age, so it's geared towards adolescents and young adults.
And that is Soluna, Soluna. You could find that on your Apple Store or Google Play. You could download it. It is a free service, and they will also provide you with, counseling and offer you at least someone to hear you out and give you the resources and direct you to where you need to go.
Yeah, we are very fortunate to be in the state of California, because all these resources were part of the governor's budget in 2022, if I recall correctly. And there's additional resources available as well that maybe we'll share more as we do more of these recordings. But yeah, that is the one thing. We're not going to go in depth here, but it's also available to parents, right? So those parents who might have a youth in their care who might be struggling with suicide, there's a link specifically that provides guidelines, things that we can do, and and again, establishing safety and getting them help.
Yeah.
And
So that is
the one thing I like about that particular link, Alvaro, is that it's really the first thing that we're told is, remember, you as the adult, let's stay calm. Don't personalize the behavior you might be seeing from the young adult, the young person who's in your care, because again, the child, the teenager might be having an overwhelming stress response, but so does the adult. And so that question that you asked, maybe we'll finish,
Yeah.
in that regard. Does asking about suicide put the idea in their head? The answer is
Right.
no.
Yeah.
The answer,
That's right there.
as I shared earlier, according to research, asking about suicide does not put the idea in a young person's mind. In fact, talking openly about suicide shows young people that it isn't, as we talked about earlier, taboo. It is
Yeah.
not taboo. It creates a safe environment for them to ask their own questions and express how they're feeling. Prepare yourself emotionally in case they say yes, and then we have the 5 steps. And so including, there's some guidelines, right, in terms of how you would manage those 5 steps. And so it starts off with asking about the suicide, but also keeping ourselves calm in that situation. And so this is interesting, Alvaro, because I
Mhm.
just thought of times that you might, anyone, right, our listeners, I'll ask you, times that you felt nervous about asking someone for help at work, and
Yeah.
that you might feel like, I'm feeling like I'll feel stupid for asking this question.
Yeah.
You had the If you were able to ask that question, especially if someone made it easy on you, and then they gave you the answer and they made you feel really good about being able to ask that question, that
Mm.
kind of culture is what we want to establish in a good working relationship, in a good working environment. And if we have a child in our care, I want people to remember that, because asking that question and then saying, yes, I'm feeling this way, is so important to know that that person is in pain and that
Yeah.
we're going to get them some help.
Right. Because that providing somebody a lifeline. I mean, we've gone through difficult times. We all go through difficult times.
Yeah. Yeah.
And when we are faced in that moment and we think that there is no other way out, and somebody comes along and you are able to open up and trust them and find that way out,
Mhm.
is, I mean, how wonderful is that, that we
Well,
can still say
yeah,
that somebody's still here enjoying this, what we call life,
right,
is very satisfying. And I think if we are able to save one person by giving them these tools having them follow 5 of these steps, is is mission accomplished,
right.
because one life is one too many.
To lose, absolutely. As we saw the data, it's staggering, and this is all preventable. I hope this has been helpful to our listeners. I'm sure it can be. And if they need more information, not only is resources like 988 never a bother, but you'll share my contact info via my email, and I welcome any inquiries.
Indeed. And so, once again, I thank you for bringing up this topic, and something that we're really passionate about it. And that's, I think, one of the reasons why I moved to create this type of podcast, was to educate, inform, and
Right.
inspire. And
Mhm.
if we are able to do that and be able to share your knowledge, share your information, your life stories, and your struggles, because it's not how many times you fall, it's how many times you can get back up when you have fallen.
Yeah, and I just want to add, thank you for the platform. Thank you for the opportunity to share this. I do this in honor for those who we've lost, and for those mothers and fathers and husbands and wives and you know brothers and sisters. I mean, there you go on and on, but for
Yeah.
anyone who's lost a loved one, right? This is about trying to prevent it from happening to someone else, and I hope this has been helpful to the listeners.
And I think everybody that's listening, and this platform is there here for you, and I appreciate everybody that has taken the time to listen. And we do this with your support. So we ask you to, if you want to follow us on social media, I again, my platforms is Sabiduría para tu Día. I have a podcast channel, and I have Instagram. I have a Twitter or X. Um, and so please follow, and this will continue to encourage us to continue to do more programs and conversations and podcasts just like this. So, once again, thank you, Ivan. Um, any last words that you want to share with us?
That was it. Just wanting to honor those who have lost a loved one, because their message is generally, let's help others and prevent it from happening. So
Amen.
hopefully this is helpful.
Well, thank you once again. This is Sabiduría para tu día, and follow us if you want to hear more of this wonderful content. Thanks.